Hey everybody, my name is Dr. Abdul El-Sayed. I'm a physician and epidemiologist. I'm co-author of the book Medicare for All: A Citizen's Guide. And in my day job, I am the director and health officer for Wayne County. I direct the Department of Health, Human, and Veteran Services. I want to talk a bit about why Medicare for All is truly a solution around the racism imposed by our current healthcare system. Yes, I said racism, and I don't say that right lightly. In our current system, you've got people who have private insurance. Those folks have a ticket into the healthcare system should they get sick or should they want to see a physician to maintain their health. But for about 87 million people, they are second-class healthcare citizens. And those people, in theory, have coverage, but they're covered under Medicaid. And because of structural racism in our country, Medicaid tends to be disproportionately the route into healthcare for Black folks in this country. And the fact is that Medicare, well, it reimburses care at about 50% the rate as private health insurance. And that patterns access to healthcare in some pretty profound ways. One of the first ways is that you got to imagine what the experience of being a Black healthcare consumer is. Even if you have private health insurance, the assumption on the part of most healthcare systems is that you're one of those second-class healthcare consumers whose care will only be reimbursed at about 50% the rate. That means that you are discriminated against actively. You are given short shrift when it comes to your care in the emergency room. Folks don't believe you as they might if you coded as someone with private health insurance, and that means that you're discriminated against in terms of your pain, in terms of your symptoms. They're not taken as seriously. And so in that respect, our two-tier healthcare system helps to explain some of the direct discrimination that Black patients face in our healthcare system. But even beyond that, there is a moral failure implicit in this. I just want you to think about this. In our country, nearly 2/3 of Black children are insured via Medicaid, via CHIP. That compares to about 1/3 of white children. Now, if you do the math, 60% of kids reimbursed at 50% the rate. In our healthcare system, healthcare for a Black child's body is worth only about 85% as healthcare for a white child's body. We literally devalue healthcare for the same flesh and blood simply because of the color of skin. Now, we know that our healthcare system could be doing so much better, not just at the point of care, but whether or not we're willing to invest in public health in the first place. And so much of the disinvestment in our healthcare system has to do with the way that it's incentivized. The fact is that in this system, the healthcare system makes money when people get sick. So we don't invest as much in public health upstream. And the reality of this thing is that our failure to invest in public health in general falls hardest on those communities for whom public health is most important. And that tends to be lower income communities whose health experience is a function deeply of the resources in their communities. And so in some respect, our for-profit healthcare system, it patterns health at the jump in the first place. Who gets healthy and who doesn't get sick, even before those people are kept out of the healthcare system by frank gatekeeping simply because they're coded as second-class healthcare consumers. Ultimately, I want you to think about what this means for someone. Your experience of the healthcare system is that you're going to be told that your pain is not as important, that your symptoms are not as serious. People are going to do everything they can to keep you out of their clinics. And that's exactly what has happened, both structurally and in terms of the personal experience of Black folks in this country. When you look at COVID-19, you look at the initial hesitance in taking a vaccination that you're told is free, when your whole life you've been told that you can't get the health care that you know you need. Pattern that hundreds of years back, when you've learned about the ways that people who look like you have been kept out, or worse, experimented upon by the healthcare system. And it shapes a lot of the hesitance that we saw from the jump. Now, we can fix this. And the reason Medicare for All fixes this is because it gives every single individual in this country, everyone in, nobody out, access to the passport they need to get full treatment in our healthcare system. Doesn't matter if you're Black or you're white, doesn't matter if you're poor or you're rich, you are covered under a system of healthcare that will guarantee your coverage independent of what you came in for and what the circumstances may lead to. So you get the care that you need. But also because of the fact that Medicare for All would align how we pay for public health to prevent illness among people our government would then pay for healthcare for. You have this addresses the disincentives of investing in public health. Rather than pay on the back end for healthcare, our system can really invest on the front end to keep people healthy in the first place. Medicare for All is critical to addressing inequities in healthcare in our society. It is the best way, in fact, I would say the only way, to make sure that every single healthcare patient, every single consumer of healthcare, I hate that word, is treated similarly, because we know that they have the same insurance at the front. And that's because our government insured them that way. But don't forget, the opposition to Medicare itself, forget Medicare for All for a second, the opposition to Medicare itself was a function of racism. The single best and most efficient tool that the AMA and other opposers of Medicare back in the 60s had was to tell Southern racists that it would integrate hospitals. In fact, it did. But the opposition to universal programs has always been about trying to keep Black folk in this country from getting access to the same healthcare resources. And we have to call that out as we fight for Medicare for All. I deeply appreciate the opportunity to speak on this with you today. And I know what Medicare for All would mean for the 1.2 million people that we serve in Wayne County, the 1.8 million in Wayne County overall, because it would finally give every single resident equal access to the healthcare system that they need and deserve. Thank you.